So it's week 4 already. You just had your first exam. If you've noticed, I've already sent out some information on exam 2. Next week is reviews already. And then the following week is the exam 2. So you have that information already so that you can start studying for it. It should be in your
Wait a
announcement.
minute, you said week 5 is exam 2?
Week 6. Next week, week
Okay.
5 is reviews. And I've put them down for you there.
Oh, okay, thank you.
Anybody who wants to do a review with me, 1-to-1, you're more than welcome to do that. I have no problem. This week, we have, a shorter class. So I've decided, I've looked at essays, exams, quizzes, and I decided that I'm going to give you your class in a Kahoots. I also have already sent you all of the PowerPoint. So you already have those. This week is chapter 21, and it's all about the child and their experience in the hospital and what they go through. And if we think about the ages of children, it really makes a difference how young or how old you are. We know toddlers don't like change. They don't like to be taken away from routines. And preschoolers a little bit better, but still don't like it. And then as we get to the school age, they tolerate it better, but still need some great explanations. And then, of course, adolescents think they know everything. So let's go ahead and let's do chapter 21, the child's experience. I'm going to do it under the Kahoots. Now, I know that Dr. Yamja is going to do one on the PowerPoint. I'm going to send you her recording so you have both. So in case, the Kahoot doesn't give you enough of what you want, you're also going to have that recording too. So we're sharing with each other and trying to help. The crazy thing is Dr. Yamja was raised at the same hospital, acute care facility of pediatrics that I worked at for 25 years. So our way that we think, the way that we teach, very similar. So I think you'll enjoy it. Just like if you got to listen to her review, you can hear it. The way that her review is very similar to me. So let's go ahead. Let's get this Kahoots done. And then it'll be the end of our day today. Again, grades will be coming out tomorrow about 3 o'clock, maybe slightly earlier, but let's say 3. Let's see what time we get done here. And I know looking through the exams quickly, I noticed one thing that was missed in the math was mLs per hour. So I'm going to do it quick. Let's go over mLs per hour. Right now, while you just did it, you know what you did right or wrong with it, and making sure that we don't give any more 2 points away, okay? All right, let's go ahead and let's get started. So week 4, chapter 21. Which child would have the most difficulty in coping with separation from parents, like going into a hospital? Because of what I just said, what do you think? And it's the toddler. The toddler doesn't like breaking routines. They want to be doing the same thing, same food, same toy, same bed, and they don't tolerate it as well. So absolutely, that one needs special care. How can we decrease the stress and anxiety of a 2-year-old that's hospitalized? So now that we know toddlers do have an issue, what are we going to do? And the most important thing is keep the home schedule. If they get up, they get changed, they have breakfast, we do the same. If they have a bath at night, we do the same thing. And if possible, we're still going to give them the same foods unless it's restricted on their diet. A 2-year-old child's been crying constantly for his mother since he was hospitalized 3 days ago. What is that behavior called? So when we're talking about this separation, it's separation anxiety, isn't it? This child is going to go through one of those 3 stages. So I know you have a discussion question. We're just going to be talking about it. Pay attention to it. Try to do it the best you can, because this is a question you'll see on HESI, on NCLEX, and on exams, okay? So yes, they feel abandoned, so they're crying. That's the first stage. Which statement best corresponds to a preschooler's understanding of hospitalization? Remember, preschoolers, ages 3 to 6. So the problem with a child getting sick, they think they did something wrong. They believe they're being punished. Sometimes as they get older, they put the name of God is punishing me, or whatever their name of that higher power is. But they believe because they hit their brother, they didn't do well, they did something bad, they didn't pick up their toys, whatever it is, that's why they feel they're there. So they need to understand that they're not sick because of that. The toddler seems more interested in her toys than the parents now. So what stage of separation anxiety is that? Remember, there's 3 stages. So this is that denial. It's like the parent now comes in and the child doesn't really not interested in the mother anymore. They've already gone through that crying, the despair. Oh my God, mommy's not here, sitting in the corner. And now they're like, forget it, you're gone. And that is called denial. Again, there's 3 stages. And, that is that discussion question. Which roommate would be the most appropriate for a 16-year-old adolescent with cystic fibrosis? Now, sometimes you've got to make a decision how to place a child. Well, what do we know about cystic fibrosis? We know it's some clogging in the lungs. They can get infections, and they're 16. So literally, we want to put them with another medical type patient, somebody without an infection. And that would be another 15-year-old, close enough, with diabetes. There's no infection, and it's safe for that both of those children. Parents of a hospitalized 9-month-old infant ask if their preschool child may visit his younger sibling. Remember, preschoolers ages 3 to 6. Their little baby brother, sister is in a hospital. They're little worrywarts at that age, right? So they do need to go in to see him, but they need to be prepared. What are they going to see? Is the kid have IVs, monitors, endotracheal tubes? What's going on? We need to prepare that child who's going to visit of what they are to expect, okay? And if they're not, they can get really scared and it could really hurt them, almost like a traumatic stress there, because all of a sudden there's their little baby brother, sister, and they've got tubes everywhere. It can be very scary. A hospitalized toddler was drinking from a cup at home, but now refuses to drink from anything but his favorite bottle. What is that? Again, this is all about separation anxiety and all the stages they go through and the things that you would see going through these 3 stages. And again, that is dealing with the anxiety of that separation. And this is when they regress. They might now, be incontinent when they're potty trained. They might suck a finger. They want a bottle, not a sippy cup or a cup. All a normal thing happens, but it is part of separation anxiety and dealing with that stress. A multi. A nurse encourages a school-age child to draw a picture after a painful procedure. Why do you think we would do that? Let's say they just had to have, an IV started, which they could consider painful, or maybe a spinal tap, right? These are scary things. Why do we want a picture? Well, these children now, they've had a painful procedure. There might be some lingering pain from it. So we want to know that we're distracting them. Children do well with distractions. And again, this is a way that we know what they're feeling. The picture's going to tell us what they were afraid of. Was it the holding down? Was it the needle? What was it? And then it's a way for you to talk with that child about what happened and why that procedure was done in, again, a developmentally appropriate manner so they understand. And that helps that child to process, okay, that's why it was done. All right, I understand. Or a little bit more understood. When is the best time to begin to prepare a 5-year-old for surgery and hospitalization? Many younger kids have to go in for tubes or tonsils, adenoids, and they got to go in and have a outpatient surgery or maybe an outpatient CAT scan or something. When are you going to start telling them? Well, it's about 4 days before, no longer than that, because they have too much time to think about it. Because these children need to be taught. Again, many hospitals for children do have child life, which is a beautiful group of people that teach children about what's going on. And they are prepared in school all about developmental stages and how to reach these children an appropriate manner. And they have all the dolls and the equipment and the appropriate equipment they're allowed to touch and feel. And then when they get to the hospital, they know what's going to happen. And when a child, especially preschooler, knows what's going on, they're going to be less stressed and they're going to have less anxiety. A 13-year-old girl has been hospitalized for the past week. What is the girl's biggest concern? Like, what is she worried about? This adolescent, what is she worried about? She's been in a hospital for a week. Remember 13 Erickson, it's all about identity, right? So knowing that, what would they be worried about? And it's their appearance. I haven't washed my hair in a week, right? I haven't put makeup on, or I'm getting a pimple, I'm laying in bed, whatever it is, they're worried more about what they look like than they've been in the hospital for a week, because it's all about body image, identity. The nurse notices the mother of a child with cerebral palsy does many things that the nurses does. Response to the mother, she redoes everything. This mother, you do everything and she redoes it. Why? She makes the bed, we make the bed, they redo it themselves. We put on a dressing, she wants to do it themselves. What's that all about? Well, What it is when you have a child who has a chronic condition, usually the mother has been doing everything and they have their own way of doing things. There could be reasons for it. So you don't want to stop that. You never want to say, no, don't do that. It has to be my way. No, that mother takes care of that child 24 hours a day, 7 days a week. So sit with her. So tell me, can you tell me how you do things so I can do it the way you want? And why do you like it that way? So I can learn from you. That mother will embrace you, they'll teach you, and they'll feel a lot better with you too. The toddler cries when I visit. Maybe I should just stay away, the mother says. What is the nurse's response for that? Again, this is separation anxiety. You know, the kid is to the point where I don't want you anymore. I've cried, you weren't there. I'm going to work this out myself. It's a common reaction. And do not send the parents away. You know, tell the parents, well, maybe do a game or something that it takes two to play so that you make that child, not make the child, but encourage the child again to start playing with you and doing things with you. Preparing to collect an admission history from parents who have recently immigrated from Russia. What should you keep in mind? You know, when we look at so many cultures out there and trying to remember everything about all of them, it's really hard to do. But we need to ask. I always ask if it's a culture I don't know. But in this case, people from Russia don't smile. They think it's inappropriate. My child's sick in the hospital and you shouldn't be smiling. It's like you're making fun of me, right? There are some times where looking at their eyes, they don't look at your face. All of these things are from different cultures. So this is something I would ask this parent, or I'd look it up, right? Or I'd find somebody who's Russian, who's a nurse. They could tell you too. Which nursing action would facilitate rapport with a child and a child's parent during the admission process? So when you are sitting there doing an assessment, it's a stressful time. You want to make it calm and as easy as possible. You don't try to rush through. You're not going to go right, address the kid, let's get her done. You know, you're not going to say, oh my goodness, this is really serious. What's going on with your child? You're trying to make it calm. And then you're going to get the information you need, and you're not going to overstress the parent, which will overstress the child too. So there's a reason why. Calm, relax, get your information, give her a hug if she needs it, if you can. A 4-year-old child begins to cry when his mother tells him it's time for his operation. What type of fear is this? What are they afraid of? So they're afraid of those invasive type procedures. Going for an operation, they have to cut you. And when they cut you, your insides can fall out and you could bleed everywhere and you're going to die. These are really what these preschoolers think. They're afraid of those things. That's why they put band-aids on everything, right? So what would you sort of tell this mother? Well, tell them that you'll put a big tight band-aid on when we're done. In fact, let's put a smiley face on it when you come out of surgery. What have you done? You've made it less stressful, and you've made it more fun, and you've addressed the fear that they're dressing there and my insides aren't going to come out. That's what the kid will think. How do you know the parents understand a hospitalized toddler's need for transitional objects? There's a lot of appropriate things that they can use. They're like distraction sort of things. But what's appropriate when they go to a hospital, right? Well, their stuffed animal makes them feel good. Now, I wouldn't have a stuffed animal if they're in the middle of an asthma attack, right? But other things, absolutely. Or it could be the pillowcase, but make sure it's clean, and it's not dirty, right? And don't ever share toys from somewhere else. You don't know how clean they are. And again, going and getting a new toy, again, it has, what somebody else's germs on it. So just give him his stuffed animal if it's appropriate. What advantages of fentanyl for an upcoming procedure will the nurse explain? Well, what is fentanyl? Fentanyl is a newer synthetic opioid. It is given intranasal, it's given IM, sub-Q, or IV, and there's many advantages of it. The number one is it's extremely strong. It is addicting, but it works really quick and it's only got about an hour life. So we can use it, have what we need it for, and it wears off pretty quickly. Okay, so it doesn't last long. Yes, it is addicting, and it's designed for all ages. We use fentanyl, an IV continuous drip for even the premature 1-pound babies. Just a little small dose so that they're relaxed and calm and they don't have pain. So it's very widespread used in pediatrics. The nurse shares the information and timelines recorded on the interdisciplinary outline of care. What is that document? An outline, an interdisciplinary outline of care? That. It's a clinical pathway. Ever hear of a clinical pathway? When you come into a hospital, we use it a lot in the adult world. You come in, you have a heart attack, a myocardial infarction. There's already printed orders, exactly what we're going to do, and we follow that throughout the admission. Clinical pathway tells you what you need for this child as they progress through an illness, through asthma, through whatever, sickle cell. Those things are ones that have a clinical pathway. It is a word that you need to know. Multi. What is the name of an adolescent that has legal rights to sign their own consents? So we know any adolescent who's 18, who's cognitively aware and alert, signs their own consent. And actually, mom and dad have to ask that child for permission to listen to or ask for lab results or anything. An emancipated minor is a younger child who has already a signed legal document that says they are in charge of their own care. So those are the two things that we would have, that they have a right to sign their own consent. Now, a legal guardian is not necessarily an adolescent. It's usually somebody over them, just like a healthcare guardian, somebody over their care. The nurse is preparing to start an IV on an infant admitted to the pediatric unit. What intervention is appropriate? So again, look at the questions, see what it's asking for, look at the answers and what makes sense. We're preparing to start an IV on an infant. We're going to involve the parents, right? Let them examine it. An infant don't know about it. They don't know what you're talking about, right? Coping techniques, it's an infant. So at this point, all they know is mom and dad's face. Let them be there holding their hand or giving them the pacifier or talking to them, soothing them during putting an IV in. And it works really well. The infant will be a lot calmer. A multi. What are the stages of separation anxiety? Had a lot of questions on that today. If you've done your discussion question already, you should be able to know these. And as I said, this is one of those concepts you're going to see on every exam, HESI, and CLEX. It's going to be there. Denial, despair, and protest. Very good. Multi. What will the nurse include when documenting the discharge of a pediatric patient? So the kid's going home. In your nurse's notes, in the chart, there's some things you must document. And the one thing, remember, that when we look at discharge and instructions, remember the teaching starts from admission, right? When the child is admitted is when we're going to start teaching them and getting them ready to go home. So we want to know almost everything. Who is the one who was there to discharge them to? Was it the appropriate legal person, mother, father? How did they go home? They could go in a taxi, right? Condition, what does the kid look like? Time, and then were the written instructions given to the parents? And one more, verbalized understanding of discharge instructions. Very important concept there too. A multi-select. What are the basic fears of a young child being hospitalized? So they're worried about, being cut inside and blood coming out. I mentioned that earlier. Separated from mom and dad is the big one. And absolutely, they're worried about pain. They don't understand cost here. So it's all the others. Very good. And last question. A multi. What nursing care would you incorporate when caring for a toddler? Little toddlers, ages 1 to 3. You have to think about what you do, how you do, when you do, right? These kids don't like change. They are stressed. So we need to be therapeutic, which means that tender touch. We need to be flexible. Huge things. Let them in their room? No. If they can, there's no reason why they can't come out. Let them go around, look at their environment. And of course, all those soothing things, quiet, calm voice, distractions, all of those stuff work really well with this age group. Number 3, SD. Number 2, qui. And number 1, Shabria. Good job, Shabria. Number 4, T and U. Or is that like you? All right, let me get out of here. So it's week 4 already. What I wanted to do, just a quick review on the mLs per hour. It was an area that many students got wrong. Do you all want to review like heparin or insulin question also? Would that help you? Yes, no, maybe so.
It wouldn't hurt.
Okay. All right, let's just start with the mLs per hour. So one of the things that I find is students like to do shortcuts. And what I say is, you've got calculators today. You don't need to cross things out because that's when errors start. So what is the formula? It is volume in mLs over time in minutes. And you multiply it by 60 minutes in 1 hour. So when you're doing this, let's say you want to give 300 mLs in 45 minutes. So how would I set that up? Well, I'm going to put 300 mLs, put it over 45, and multiply it by 60. And what you do in these problems, and it's one of the things that I have found through teaching pharmacology, teaching dosage calc, well, about 7 years now, that if you multiply the top numbers and then divide the bottom numbers, you will never have to round at all. And it will make better sense when you're doing it. So let's look at that. 300 times 60. And I always do it twice because I have these little short, little pudgy fingers with nails and I hit wrong numbers. So if I get the same answer twice, I know I'm doing good. Divided by 45, and my answer would be 400 mLs per hour. So that's the one when you have time that's less than an hour. Now let's do one. I want to give 500 mLs in 2.5 hours. Okay. So my volume in mLs is 500. I want 2.5 hours. And I always set up the problem first, then I go back and make changes. That also eliminates problems. So this is not minutes. I have to change it. So it's 60 plus 60 and a half is 30. So it's going to be 150 minutes. So again, multiply across and then divide. So 500 times 60 equals 30,000 divided by 150. And if you notice, even if it was 2 hours, I'm not going to do any crossing things out. Just multiply the whole thing, use those numbers. And remember, sometimes those numbers are big, and it's okay. And your answer would be 600 mLs per hour. Okay. Does that make that one a little bit easier to understand? All right, let's go to heparin. Let's go to the insulin, which a lot of times it's like, I don't know how to do that question. Well, I only use 3 formulas when I do math. I have mLs per hour, I have drops per minute, and then I have a dose question. The dose over what you have on hand times the quantity it comes in. So I'm going to give heparin, let's say I want to give 5,200 units per hour. And I was sent this bag and it has 25,000 units in it in 500 mLs. So what is my dose? I want to give. The doctor prescribed. The doctor wants you to deliver. I want you to give 5,200 units. That is my dose. What do I have on hand? It's the amount of medicine inside the bag. And the bag is 500 mLs. Now, many students go, but how do you know that's mLs per hour? Well, anything over anything, 1 over 1, 2 over 2 is 1. So units over units cross out. So the only label that's left is my mLs. So we know it's mLs per hour. So again, multiply the top. 5,200 times 500 and do it twice. And when you see big numbers, don't get scared. You will see big numbers. And let's just divide that. And my answer is 104 mLs per hour. Does that make a heparin problem easier for you?
Yes.
Okie dokie. Anybody again who wants to, do math with me? Actually, I have made a new math sheet specific for the PN. I have a very short video that goes with it, 22 minutes. I'll send it to you. Any of you who have difficulty math, it's 22 minutes and it will help. It'll again reemphasize those things that I just said. So that's all I have for today. Remember, next week is going to be reviews. Please go to them. Again, I will record them and I'll post them in the announcements. Anybody have any questions?
I have a question.
Sure.
Are you gonna post the math video that you were just talking about in the announcements?
I'm going to do it today with this video.
Okay.
With your week 4, I'm going to put the video for the math and I'm going to put the worksheet that I also made there, which has your answers too. There are 15 questions, similar to what you're going to see on your exam. Okay.
Okay.
All right. Thank you, everybody. And your grades will be out tomorrow by 3 o'clock. Thanks for your patience.
All right.
Thank
Thank you.
you.
No, thank you.